The doctor is in on a new blood test that could be a game changer in the treatment of serious childhood allergies. It's called the BAT test, and early research shows it can quickly and accurately provide information about life-threatening reactions to things like peanuts and shellfish without the risk of causing a reaction, unlike the more familiar and uncomfortable skin pricks and oral tests. Dr. Lolita McDavid is a pediatrician with the Rainbow Babies and Children's Hospital. Good to see you, doctor.
Hi.
Well, so it's in the testing and research phase. When will it be available, Dr. McDavid, and how is it going to work? Is this something we'll be able to use at home, or will we have to come see you or bring our children to see you to get tested?
Well, first, there were only 67 patients in the study, so let's slow down. Everybody's not going to be able to use this. This still is very much in a research phase. So what happens with allergies now is you can get a skin test, which is the skin prick test, but that will tell you if you're allergic to something, but it won't tell you how severe your reaction is going to be. So this is called the BAT, the basal activated test, and what they do is they look for basal cells, and they did a study where they gave patients things that they could be allergic to, although it was double-blinded, so they didn't really know if the patient was getting an allergen or not. And then they counted the basal cells in the blood, so it was a simple blood test. So it's better than the skin test in terms of severity. You may have an allergy to something and all it causes is maybe just a little tingling in your mouth if you eat it. Or you can have it where you get into what we call anaphylaxis, where you can't breathe and everything swells up inside your body and your trachea shuts down. That's a severe reaction. This will tell you whether or not you're going to have a severe reaction versus a skin test, but still, the gold standard is what's called the challenge test. And you get that at an allergist, and they either give you either inhale or orally ingest whatever the allergen is they're concerned about. It has to be done in a doctor's office because they're sitting there with epinephrine in case you have a really bad reaction.
Sure.
They can stop it. So
Dr. McDavid, so pardon me though, but so when this blood test becomes available, is it something that I'll have to get done at the doctor's office, or will I be able to? Okay.
Yeah.
Yeah. And you know, I find, doctor, and you tell me if you find the same, that there seems to be more people with food allergies these days. Am I on point there, and why is that?
Well, in pediatrics, we think there's more allergies because we're cleaner. I mean, you know, kids don't get exposed to things as much as they used to and then have, you know, where you didn't have a problem with it. So now we're so clean that kids get reactions from all kinds of things that they didn't get before. There have always been problems with shellfish and peanuts. Those you're really concerned about because those can be really, really severe.
Yes.
You know, if you have a reaction to pollen or tree mold, you know, you got the running nose,
exactly,
and you're doing the allergic salute all spring, but you're not going to die from that. So there's certain things you're really concerned about, and if you know that you have those allergies, then you need to have a challenge test because that's still the gold standard.
Absolutely. Dr. McDavid, if you could tell me, is this other blood test available soon? How soon? Quickly, please.
Well, it's going to be a long time. They need a lot more patients in their studies.
Okay. Well, it was a pleasure to talk to you, Dr. McDavid. Thank you very much.